This video will discuss trigger finger, including symptoms, causes, diagnosis, and treatment options. Symptoms of trigger finger include pain at the base of the finger and stiffness. The stiffness can commonly occur in the mornings when waking up. There may also be a clicking or popping sensation with movement of the finger. If severe enough, the finger may actually lock up with difficulty in straightening out the finger. These symptoms are caused by swelling along the tendon, inside small tunnels, which limits movement of the finger. Causes of trigger finger include forceful, repetitive gripping, or inflammatory medical conditions such as diabetes and rheumatoid arthritis. Anything that causes inflammation can cause trigger finger. Most of the time, the cause cannot be identified. Ultrasound examination can be used to evaluate these symptoms. This is an easy, painless, and quick evaluation performed at the initial visit. The ultrasound can evaluate all the anatomy and can grade the severity of the trigger finger by measuring the thickness of the pulley. This image shows the tendon going through a passageway of tunnels along the bones. The first one is called the A1 pulley. This is the one that is affected with trigger finger. If we look at the top section, we see the area that can be measured with ultrasound to grade the severity. The pulley becomes thicker as the severity progresses, which limits the ability of the tendon to pass through and move the finger properly. The thickness of the pulley corresponds to the severity. In patients without trigger finger, this is below a 0.62 millimeter threshold. With patients with stage 1, which is early trigger finger, they are at least a 0.62 thickness. As this stage progresses to stage 2 and then stage 3, we see an increase in the thickness of this pulley. Non-surgical treatments for trigger finger include stretching exercises, splints, steroid injections, anti-inflammatory medications, and an anti-inflammatory diet. Steroid injections are typically the most effective non-surgical treatment. However, they are not as effective if you have a more severe stage, diabetes, or involvement in multiple fingers. These are the results after a steroid injection from the American Society for Surgery of the Hand. After the steroid injection, 40% of patients do not improve. These patients will then require surgery to relieve their symptoms. 60% of patients improve, however, within 1 year. 60% have a recurrence of symptoms that will require surgery to finally relieve their symptoms. The Endotech trigger finger release is performed under local anesthesia. A small amount of local anesthetic is injected to the surgical area. As you can see, this is a fairly easy process and does not require the placement of an IV. The surgical area is numb after several minutes, and this process reduces postoperative pain significantly and has much greater patient satisfaction and less risk than those who have procedures under sedation or general anesthesia. The surgery is performed with the Endotech endoscopic trigger release technique. This procedure is a patented technique only available from providers at the Fitzmaurice Hand Institute and performed at the Endotech Surgery Center, which is the first and only center of excellence for minimally invasive hand surgery. Using a minimal incision along with a small camera, the thickened pulley is released, allowing more room for the tendon and relieving the symptoms. There is only a minimal incision created to perform the procedure. The incision is closed with absorbable sutures, so no need for suture removal. A small Band-Aid is used for dressing, and light motion can be started immediately. In comparison, here is the traditional surgery with a larger incision and sutures that must be removed. The results of trigger finger surgery using the Endotech system show a 36% better outcome compared to traditional surgery.